I write about skeptical doctors in the afterlife, of what convinced so many skeptical oncologists, cardiologists that I studied or that I interviewed, was that many people, when they die, they'll be above the operating table. Like one doctor I interviewed, Dr. Sabum, said this one patient was above the operating table when their heart stopped during surgery, and noticed that the other surgeon there had failed to wear scuffs over his white shoes, and described the shoes. Another patient was having had a brain aneurysm. They drained their entire body of all blood, stopped the brain waves, covered the eyes, put clickers in the ear to make sure there were no senses at all. And yet she's above the table and is able to describe what went wrong with the procedure and how they had to put something in her artery in her leg, could describe the saw that looked more like a toothbrush with a socket set, she said, not what you would think of a saw.
How do these doctors,
again,
they have no grid for this?
Well, and this has been written up in the Journal of the American Medical Association, in Europe's most prestigious medical journal, The Lancet, 900 scholarly publications. And so there is incredible evidence that there is, in fact, life after death. But what I find even more fascinating is when you look, everyone is a bit different, and they all have their interpretation of it, because truly it's an experience of life beyond our dimensions. There's beauty, there are mountains and trees and flowers, but all of it, they say, they experience not with 5 senses, more like with 50 senses. What I've come to believe is that this experience is the shadow of the real thing.